chose is a 55-year-old female. She enjoys things such as kayaking, gardening, and baking as just some of her everyday things that she likes to do. She has a diagnosis of a left wrist fracture. She also has had some other carpal fractures in her wrist as well. She also struggles with left hand weakness, left arm weakness. She has osteoarthritis and has had carpal tunnel release. Her current level of function, she's mod A with her left upper extremity functions, as well as her digits on her left upper extremity. As far as her right extremity goes, she's independent on that side, and her left upper extremity also has low tone, but as far as from the waist down, her lower extremities are independent. As far as her goals go, she wishes to get back to her job, which she worked as a construction worker. She also has a goal to be able to do a full gardening session, as well as meal prep without modifications, and make functional fist on her left upper extremity.
The major client factors, performance skills, and activity demands for the activity we chose, which was baking cookies, are praxis, selective attention, working memory, visual and tactile discrimination, visual acuity, proprioception, muscle power, muscle endurance, joint mobility, eye-hand coordination, bilateral integration, crossing midline, and fine motor control. The activity we chose for this client was baking, and the client factors, performance skills, and activity demands are praxis, selective attention, working memory, visual and tactile discrimination, visual acuity, proprioception, muscle power, muscle endurance, joint mobility, eye-hand coordination, bilateral integration, crossing midline, and fine motor control. Stabilizes, positions, reaches, bends, grips, moves, lifts, walks, transports, chooses, gathers, organizes, navigates, attends, manipulates, coordinates, and heats. The supplies needed for this activity are cookie mix, eggs, butter, butcher paper, cling wrap, baker's joy spray, and flour. The tools required are baking trays, cooling racks, oven mitts, cookie cutters, spatulas, and a rolling pin. The equipment needed is a mixer, an oven, a microwave, and a refrigerator.
Some other activity demands that are needed are, as far as size and space goes, we're looking at arm spans length. For arrangement, you just need everything that you have to use for the activity to be in the lab and available to you. For the surface, the best surface to use is going to be a flat tabletop with lots of counter space. The lighting needs to be adequate enough to where you can see what you're doing. Ventilation's not applicable, room temp not applicable. For noise level, we're looking at a quiet classroom level type of noise with just some quiet conversation going on. And as far as social demands, you should be able to share equipment and interact with your peers.
The activity we chose addresses the client's goals and objectives by focusing on meal prep and works on her gaining more independence in her own life for meal prep without using adaptations, and it focuses on making a functional fist with her left hand by having her grip different size tools and types of tools while baking.
And some areas of occupation that would benefit from this activity, when we're looking at meal preparation and cleanup, as she mentioned, it's working on, that's one of her goals, so it's just important to integrate this, and the activity itself is working on that. As far as leisure participation goes, this is an activity she enjoys doing, so it's very beneficial for her to see, hey, I enjoy doing this. This is something that I can participate in day to day, just kind of opening up her ideas as far as this goes. For personal hygiene and grooming, this works on helping to improve her grip. So when you're working with personal hygiene, we're listing things such as brushing your hair, things like that, where those things all require grip for you to use. As far as dressing goes, we're working on fine motor a lot in this activity when we're doing things such as rolling, opening the butter, things like that. And that's just going to help when we're dressing, having to grip your shirt and use, fine motor movements to work on dressing.
This activity can be adapted for our client. If the client cannot grip scissors, adapted scissors such as spring-loaded scissors can be provided. She may not be able to lift items high enough or reach them off the shelf. So smaller bowls can be used. The environment can be set up a little bit differently. Client may struggle to grip the rolling pin. Built-up handles can be provided, as well as automatic rollers. Client may not be able to arrange cookies properly. A grid can be provided with outlines of where to put the cookies. Client may not be able to grip spatula, and a built-up handle can be provided for that. Client may struggle with cracking eggs due to decreased pressure sensation, and the client can be provided with an egg cracker. The patient may also struggle with spreading flour onto the table with her hands, and a sifter can be provided to help her get better range with that.
The reason we chose this activity for the client is because the client enjoys baking. As OT practitioners, we like to provide interventions and activities that are meaningful to the client. So because this is something that she enjoys, it's important for us to note that and incorporate it in her sessions. Another reason is the client has a lot of goals to work on grip and grasp in her left arm and hand. So this is something where that is incorporated throughout the task. So it's important to note that and include activities that include things like that. So this is an activity that has a lot of opportunities to work on grip and grasp. Another thing is her left upper extremity. She has weakness in that, as we mentioned earlier, and this has a lot of opportunities to integrate your left extremity as you're going through different activities and tasks in this activity.
The cultural relevance to this client. Because the client is a mom, she previously participated in meal preparation for her son, and she viewed this as one of her many duties of raising a child. This activity is more appealing to an older woman rather than an older man, because in our society, women typically prepare meals and take care of the family inside the home rather than the men.
Thank you.